Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's jump right into a real medical mystery. Picture this. You're in the emergency room, and a 22-year-old guy is wheeled in after a car crash. But the story the paramedics tell you is weird. It's the kind of story that sets off alarm bells.
So let's get this straight. He's knocked out, then he's awake and talking, and now, right in front of you, he's unconscious again. A patient who seems fine 1 minute and then just crashes the next. You gotta know that pattern is a huge flashing red light in the ER.
So the big question, the one that everyone in that trauma bay is asking, is what on earth could cause such a dramatic up and down? What is going on inside his skull right now?
To figure this out, we have to think like detectives. Every single thing we know about this patient, every symptom is a clue. And it's our job to piece them together to solve the case.
Okay, let's break down the evidence. First, that whole out, then in, then out again pattern, that's not just random. It has a name. It's called the lucid interval, and it is the classic textbook sign of one very specific kind of head bleed. Then you see that bruise over his temple. Well, that's no accident either. It's sitting right on top of a major artery. And his left pupil getting a little bigger? That's a direct signal telling us exactly which side of the brain is getting squeezed. You put all of that together, especially in a young guy, and a very specific diagnosis starts to come into focus.
But before we can officially name our culprit, we really need to understand the crime scene. So let's do a quick tour of the anatomy, looking at the layers that protect our brain.
Think of your head like it's wearing layers of armor. On the very outside, you've got your scalp. Under that, the hard protective skull. But then, between the skull and the actual brain, there are these three crucial membranes. The tough outer layer called the dura mater, the spidery arachnoid mater, and finally the super delicate pia mater, which hugs the brain itself. Any bleed inside the head is happening in a space between these layers.
And in our patient's case, all the evidence is pointing straight at an epidural hematoma. Now the name tells you exactly where it is. Epi means above, and dura is that tough outer layer, so the bleed is happening literally above the dura.
Now here's the crazy part. There isn't actually supposed to be a space there. It's what we call a potential space. But when a skull fracture tears an artery underneath, that high-pressure blood starts spraying out and it forcefully rips the dura away from the bone, creating a pocket for blood that just keeps getting bigger.
And this is exactly why it's so incredibly dangerous. We're talking about an arterial bleed, which means the pressure is high and it expands fast. On a CT scan, it has this very distinct lens shape. And you know why? Because the dura is tacked down really tight at the skull's suture lines, so the blood can't spread out. It's trapped, so it just bulges inward, creating that classic shape.
So let's circle back. How does this explain our patient's bizarre symptoms? Well, the lucid interval makes perfect sense now. The first impact causes a concussion, which knocks him out. But the bleed is still tiny, so he wakes up and feels kind of okay for a bit. But that artery is still pumping blood. The pressure is building and building, until it gets so high that he loses consciousness again. And the pupil? That growing pool of blood is literally squishing his brain, putting pressure on the nerve that controls the pupil on that side. It all just clicks into place.
Now, to really be sure we've got our diagnosis right, it's super helpful to compare it against the other usual suspects. Because believe me, not all brain bleeds are the same.
The one it gets confused with the most is a subdural hematoma, but they are worlds apart. Think of an epidural as a ruptured fire hose. It's arterial, high pressure, and fast. A subdural is more like a slow leak from a garden hose. It's venous, low pressure, and slow. Epidurals are the classic injury for a young person after a bad hit. Subdurals, you see those more in the elderly, where the brain is shrunk a bit, stretching out those delicate veins.
And here you can see the whole lineup. Epidural, between the skull and dura. Subdural, one layer deeper, between the dura and arachnoid. And then you have a subarachnoid hemorrhage, which is deeper still, usually from a burst aneurysm. Each one has its own space, its own type of vessel, and its own classic story. The lucid interval, that belongs to the epidural. The slow decline in an elderly patient, subdural. That sudden thunderclap worst headache of my life, that's a subarachnoid. Our patient's story only fits one of these profiles.
So after going through all the evidence, the anatomy, the other suspects, we can boil this whole thing down to one single, incredibly important takeaway.
A young patient, a hit to the side of the head, that classic lucid interval, and a pupil that's getting bigger on the same side as the injury. When you see that combination of clues, you are looking at an epidural hematoma. This is one of those patterns that once you learn it, you never forget it. And in the real world, recognizing it in seconds can absolutely be the difference between life and death.